see what advice you have to offer to pet owners.
Already touched on getting insurance. Like for her, I have insurance and I'm a veterinarian because there are costs no matter who you are. And like I said, say it again, it saves so many lives really to get good insurance that has good coverage, and make sure you investigate your options for insurance as well. Best advice too for pet owners, new pet owners, really research what you're getting. Especially with dogs. If you need a purebred dog, do some research into it and know about what you're getting into. So many come with their own set of issues and problems that I see so many clients come in and not that they regret having that pet because it's part of their life, but they wish they would have known that certain breeds come with certain things. So do some investigation. Ask for advice if you have a vet friend and follow their advice. I have a lot of people that ask me what kind of dog they should get, and I give them my honest advice, and then they go and get actually the dogs I would never recommend anybody. So do your work, help a pet in need, and don't go for a brand new puppy or a brand new kitten if you can, and adopt one that needs a home. There's so many nice pets out there that need homes. Seek veterinary advice sooner rather than later.
Totally.
If you have an issue, the sooner the better. If we can catch something, even a minor illness, let go too long can become quite serious and quite expensive for you. Catch it earlier, much better off. And serious illnesses, again, you catch them earlier and you're doing much better.
Yeah, totally.
Find someone that you trust and can work with.
Yeah, right. It's a team thing. You can't DIY everything off Google. You really need to have somebody that you're comfortable with, and you need to have the mindset that you need to go in when it's time to go in. I know so many people don't want to go into the vet because they don't want to pay, but you can just make things so much worse for yourself if you're hesitating and holding back and it's something serious.
Low-cost options, too. You don't have to necessarily go to a referral hospital. There are low-cost veterinary clinics that are staffed by very good veterinarians. They may not be the best ones to do really advanced work and serious problems, but you've got a low-cost option out there.
You're saying so many breeds come with problems. That's both behavioral stuff and medical problems, right?
Oh, for sure, yeah.
What were you kind of referring to? Were you more referring to coming with medical problems or coming with behavioral?
Medical for sure. Medical and surgical problems, we can almost guarantee certain breeds are going to have certain things happen in their life. But also lifestyle. Again, a dog, focusing on dogs, cats are one size and not as many purebred. They have hybrid vigor. I think they're, the mixed breeds tend to be, I'm going to get all the purebred breeders mad at me now. Mixed breeds, I think, have hybrid vigor and tend to be healthier. But your lifestyle or your apartment dweller, probably not the best place for a newfie. Huge, heavy coat, maybe not the best decision. So keep in mind where you live, how you live, your lifestyle. Are you really active or are you sedentary? If you're sedentary, you don't really want running.
They're like, most of the people that come in with purebreds that came with medical problems were not ever informed about this. If you have a dachshund, like 95% of them by the age of 1 have degenerative changes in their discs. Most of the people I see with dachshunds in the emergency room honestly have never heard of IVDD. They're like, IV what? I'm like, okay, well, when you purchase a dachshund, you should have to sign a paper. I understand what IVDD is. I understand that the surgery to allow them the ability to walk is going to be $6,000 to $10,000. I'm prepared for that. You should have to sign off that you understand what they're coming with. And ideally, the breeder should have some kind of statistics on how many of their previous litters developed these problems. But there's kind of a big knowledge gap when it comes to the medical problems that come with purebreds, not only on the breeding side of things, but also on the consumer end. People pay thousands of dollars for a purebred, but I remember there was a 1-year-old dog that was waiting for surgery to fix some congenital problem in its diaphragm, and the day before its surgery it herniated a disc and was paralyzed. And the guy goes, I bought this for my wife because I thought it would be cheaper than the purse that she wanted. And I'm like, you bought a Frenchie?
No.
Exactly.
We didn't say the word yet, but French Bulldogs is as wonderful personalities they are, as cute as they are.
So cute.
They are such trouble. We went from
they weren't even a year old and they were already looking at 15 or 20 grand. It was his first birthday. I was just like, sorry to tell you this. Sorry you didn't hear.
I've been in this hospital working with the neurology service for 20 years now. And we started off that our neurology service was mostly dachshunds. Probably looked at their caseload and it was 75% dachshunds. And now that's gone to the point now I can pretty much guarantee I'll walk in my hospital any day and there absolutely is going to be a French Bulldog in there. And it's most likely going to be in the neuro service or intubated because of respiratory issues. And it's become a really sad situation. Not to say they're all like that, because there are some breeders that are very conscientious about what they're putting out there. And there's a real push from the veterinary community too to select for certain traits in the Frenchies that hopefully going to eliminate some of their problems. We don't want to see them go because they're wonderful dogs, but
they're so cute.
Surgical problems are enormous.
Yeah. Well, that was great advice. Dr. Enberg, what's your favorite animal?
My cat, Gigi. My favorite animal, I've become obsessed with octopus. So I don't see them as a patient, but I am an avid snorkeler and diver, and if I find an octopus, I'm done. That's where I'm sitting and watching. So yeah.
They are so
favorite
cool.
animal octopus now.
Supposedly every animal in the animal kingdom, the retina evolved from a single ancestor, except the octopus. There's evolved independently.
Wow, I've never heard anybody else that knew that thing.
Oh, you knew that?
Fact. Oh yes,
yeah.
It's very.
Yeah.
There's
it's like their
a
retina
book
is
called
like stacked backwards.
It's like the eye evolved in two different branches. Everyone except the cephalopods. Cephalopods, they evolved their own eye. Everything else that has an eye evolved the same. Yeah,
it's almost like they were dropped from outer space.
Yeah. Oh. Yeah. Other Minds talks about that. It's a book, and then everybody's, I'm sure, seen My Octopus Teacher by now. So it doesn't talk about their eyes so much, but yeah. Fascinating creature.
Cool.
So besides my Gigi octopus, I don't favor dogs or cats at work. Everybody thinks I'm a real cat person at work. Cats get really sick and are hard to bring back. Dogs are much easier to treat than cats, I think. So that's the only reason I would rather see a dog at work. Everybody says, "Oh, Trevor's the cat guy," just because I'm crazy about my own cat.
Aww. Well, thank you so much for joining us on
thanks for having me.
Our podcast. So it's such an honor to have you. And you should come back again. We have so many questions everybody wants to know. So you have a wealth of information to share. I'll talk to you later. Thanks again. Bye.